So thank you once again, and I will talk something about the work which we are doing in the headquarters, and I will try to. This work is still in progress, and I will try to show you some of the complexities which are associated with the development of this kind of work. So basically, this is about a manual on operations, on how WHO recommended strategies can be implemented. So it will talk about methods of vector control, the surveillance, sentinel sites, and other things, and other aspects of monitoring, evaluation, some indicators. So something about objectives, some questions program managers come across, disease burden and complexities. So this will be a repetition of what Dr. Supriya presented, and something about various approaches and methods and likely a decision tree for program managers. So basically, the aim of any vector control program is to reduce or interrupt transmission of disease. And taking this into consideration, the objective of this manual is to propose to the national program managers handling the vector-borne program, vector-borne disease control programs, on the operational aspect of WHO recommended strategies, and also propose some of the minimum recommended standard vector surveillance methods and monitoring indicators for certain context where vessel leishmaniasis is targeted for elimination as a public health problem, and then other contexts in general. So this manual is expected to achieve certain impact, and those colleagues who are from WHO, they will know the general program of work 13, and then various sustainable development goals, targets, the biennial program of WHO, and the recently launched neglected tropical diseases roadmap 2021-2030. So this manual is expected to provide some guidance to national program managers on how to implement the recommended strategies. I read in the chat some of the participants mentioned about lack of sandfly control program, or there is malaria program taking care of this aspect as well, which is a very good sign. So, who is intended to benefit from this manual? As I said, this manual is not only for the officers in the ministry at the national level, but it will also help program managers at the sub-national or provincial or district level. So it will help the implementers. It will also help the vector control experts, entomologists, and also some areas it will talk about the future research operational research, implementation research, to generate more and more evidence. So, what one should expect from this manual? This is still work in progress, but I thought this is a very nice opportunity to at least present what we are bringing in few months' time. So, one thing one should note that it is not a guideline, which means that no new guidance will be provided in this manual. This manual is focusing on how WHO recommended strategies can be implemented in various eco-epidemiological areas. And it will also talk about the uh, certain tools which are in place, and I will show this in next slides. uh, Also different approaches, the concept of those approaches, the field techniques, uh, the the sentinel sites, the lab aspect about vector and entomological surveillance, and then how we measure our progress through monitoring and evaluation and indicators. So we expect that this manual should be available either towards end of quarter 2 or early quarter 3 this year. So that's a good news that we can expect this manual within this year. Having said that, you can see this map, uh, the and you can see more than 1 billion population is at risk of contracting leishmania infection. This map talks about the burden of visceral leishmaniasis globally, and you can see in the maps there are 4 red circles which highlight the 4 hotspots or eco-epidemiological foci which have the highest disease burden in the world. Is Indian subcontinent or South Asia or Southeast Asia region of WHO, the Eastern Mediterranean region of WHO, which contributes around 21%. Every fifth patient comes from this area. The Afro region and the region of Americas. You can also see that in each of these foci, the uh, each of these foci, there is a different species of parasite. The transmission is unique for a particular context. For instance, anthropoonotic transmission for Southeast Asia region. There is a single vector which causes the disease, and then there is very effective single dose liposomal amphotericin B, which treats around 95% of patients. When we talk about other regions, here the situation is more complex, that you have more than one parasite, you have different transmissions, anthropoonotic, zoonotic, multiple vectors. There are less sensitive rapid diagnostic tests, and then these areas, they don't have the good efficacy of the single dose liposomal amphotericin B. Therefore, these patients in these areas, they require either long treatment or the combination of two anti-leishmanial medicines as the first line treatment regimen. And same is the case for Americas, where the transmission is zoonotic and the medicine is also different. So it's a complex eco-epidemiology of the condition. And you can see that estimated around 50 to 90,000 cases occur annually, of which, because of poor surveillance or weak surveillance, only around 25% to 45% cases are reported to the WHO. If we talk about the regional distribution, and as you can see, it is also reflected in the red circles, and you can see top 10 countries of your region, where Sudan has the highest disease burden with around 2,500 cases. WHO has proposed a operational definition of classifying an endemic country to high burden or not, and that classification for visceral leishmaniasis is 100 or more cases, then that country WHO considers as a high burden country. So therefore, there are four countries which of your region or the region of Eastern Mediterranean, which come under high burden countries. Similarly, the cutaneous leishmaniasis, which is a more serious problem, and as you have seen in the previous presentation, that this region contributes almost 75 to 80% of the global burden. And you can see top 10 countries of your region where disease is, they share the highest disease burden. Just to give you a glimpse of the complexity of one condition out of several, I have taken just one example to show you the complexity aspect. I'm not talking about cutaneous leishmaniasis or PKDL or mucocutaneous condition, the other three forms of the disease. I have taken the most fatal or severe form, the visceral leishmaniasis, just to give you idea of how challenging it is to control the condition. And this relates to the vector control interventions and instituting a well informed vector control programs for most of the areas. So you can see that if you look at the behavior of vectors in Southeast Asia, it's mainly endophilic and sometimes peridomestic, which means in and around houses, mostly in houses and then in animal shelters, because of the practice of keeping animals within the vicinity of human dwellings. Whereas in East Africa, it's exophilic, sylvatic, outdoor, transmission is outdoor. And then in Americas, again, it's either exophilic or peridomestic. Therefore, the control, the proven control methods in Southeast Asia, as I said, there is a single vector and it's mainly endophilic or peridomestic. Therefore, you have indoor residual spray, very effective strategy. Or you can use the insecticide impregnated long lasting nets or bed nets. through the approach of integrated vector management. Whereas in Eastern Africa setting, so like Sudan and Somalia, from this region they qualify for this. There is no proven vector control strategy which can be expanded, and the same is for Americas. When it comes to reservoir and then how disease manifest, you can see that the uh, the disease is mainly in humans in one setting, and then it's in humans and in animals in other settings. And this relates to the complexity of how we can control, or what tools we have to control the disease. The clinical severity is moderate in Southeast Asia, whereas it's severe with comorbid conditions, and in severe in the Americas and East Africa, respectively. So with this, the challenge or the questions uh, any program manager which is in charge of vector control, vector-borne disease control programs, is that whether the endemic zone is scattered or it's very widespread geography, like in Sudan and other places, whether the transmission is anthroponotic, where there is no animal reservoir between sandfly and humans, or there is a domestic or wild animal acting as reservoir, and then the transmission is mainly zoonotic. If at all it is zoonotic, then whether there is one reservoir or several reservoirs. Similarly, other questions, and these questions one has to ask before deriving conclusions to institute vector control methods and adopting various approaches. And this is what we are trying to address in the manual within the complex eco-epidemiology of the disease, looking at various reasons, various transmission settings. So these questions are important, that whether vector, what is the vector behavior, whether it is endophilic, exophilic, endophasic, exophasic, or when you have answered every question, then do you have a good uh, class of insecticide to which vector is still susceptible. So these questions are important for any program manager, and this manual should help those settings where they are still trying to understand the transmission and ecology of the condition. Then what are the different determinants which affect the approach towards vector control? And basically, one has to know the triad of the epidemiology of which are the vectors, the host, and the transmission cycle. And then in the vector, the various aspects of vector and the ecological association, which is important for transmission, whether it is seasonality, it's circadian rhythm, the host feeding behavior, the flight range, and then these aspects have been very nicely dealt with in Dr. Samira's presentation. So then this manual will talk about these aspects, and this will then summarize what are the current evidences available of vector control strategies which have been attempted or proven, or which area which needs to be piloted or done on trial basis to get more experience and generate more evidence. So Dr. Samira has very nicely presented this, uh, the the vector and different parasites it carries or transmits, and then how the what is the distribution, the geography of its presence, and then various ecological parameters which are needed for the survival of these vectors, and then its uh, whether there is a predilection towards humans or not. For instance, you can see some uh, sandflies, they have very aggressive uh, towards human beings. Therefore, they will prefer the having a blood meal for human in relation to other options they might have. And this helps, as I said, that all these things are necessary to know before deciding on which method to use, how effective it will be, what to use. These things are very important for uh, any transmission setting. So this is about 10 different sandflies, their transmission capability, their distribution, and then other two aspects. And this is part of the manual which will help the national program manager to identify which area he comes from and is applicable to a particular setting. Therefore, I'm sorry for this very small font size. I don't know if you are able to read it. So, what after addressing uh, previous questions and factors and determinants, what we are trying to propose is to have some kind of a decision tree, or a decision making capacity is there at the national level to decide on uh, what kind of methods to go for to control sandflies. So, for example, I'll read few, and you can see here the bold means these are the decision endpoints. In italics, you will see in blue color, these are not currently WHO approved. Therefore, in the last boxes, last column, you can say, in most of the boxes, they read blue and it says pilot, which is mainly for researchers. So just I'll read few. So you have done the vector assessment. You have identified which are the primary or secondary vectors. You have understood their behavior. You have already done that assessment in various transmission settings. And then you have arrived that either the type of sandflies available are only nuisance, creating nuisance, and they never bite humans. Therefore, no control is required. And if you say that no, its vectors are anthropophilic, or they have predilection for animals, but they can still accidentally bite humans, then you definitely need to do something depending on further questions and results. So once you have this assessment and understanding, then you ask second question, that whether vector or vectors are peridomestic or vectors are endophilic, endophasic. And this is only one type of decision tree. So we are trying to develop more decision tree to help program managers to take a firm decision. So if you say that yes, vector is peridomestic, then you try to understand that whether the breeding is mainly in animals' burrows, or they rest in the vegetation. And then similarly, if the vectors are endophilic or endophasic, then the host is domestic, or the transmission is sparsely populated and scattered. So you take each boxes, and then you ask certain questions which are given in this tree, and then based on that you take a particular decision. For example, here, if you can see my cursor, the host is domestic, and then there is a human host and host living in shelters closer to humans. Then it's a very straightforward case that you apply indoor residual spray to houses, inside houses, and then you also cover animal shelters. Similarly, I'll read another uh, bold box where it says you you see that uh, vectors are susceptible to different insecticide formulations which are available in your country for indoor residual spray. And then you decide, you say that okay, the indoor residual spray of household and animal shelter is the preferred choice in my setting. So uh, there will be other decision trees also to enable the program managers to take certain make some informed decision. So what should be the approach? And it is recommended in the manual that more than one method should be used in an integrated manner. So before instituting planning a vector management or vector control program, various aspects need to be known. For example, as I said, assessment of the ecology of the area, then the operational targets, the population needs to be covered, the area needs to be covered, urban or rural, then different choices of proper methods. You need to have a regulatory framework in the country, and then these approaches should be cost effective and very well acceptable to communities, along with the mechanism of quality assurance and how we can measure the progress of our intervention. So I've taken one example, maybe two. The method is chemical. Here, chemical means you use insecticide, and then you have to ask certain questions. what to apply, which class of insecticide to apply.